Hey, stop right there. Before you schedule your next annual checkup, I need you to hear something that most doctors will never say out loud in their offices. Some of the most commonly recommended medical screenings after the age of 65 can actually do more harm than good. I know that sounds shocking. I know it goes against everything you've been told. But the evidence is there, sitting in peer-reviewed journals, and it's time someone explained it to you plainly. I'm Dr. Thomas, and I've spent over 2 decades in clinical medicine. Today I'm sharing 5 medical checkups that I personally would never get if I were over 65, and more importantly, why. Now, a landmark 2018 analysis published in the British Medical Journal reviewed over 52 randomized controlled trials involving more than 500,000 patients and found that general health screenings in older adults showed no significant reduction in mortality or serious illness, and in several cases led to a cascade of unnecessary treatments that caused measurable harm. 500,000 patients. Let that sink in. Before we go any further, I want to tease something. Number 2 on today's list is going to surprise you the most. It's one of the most celebrated, most advertised screenings in modern medicine, and yet for people over 65 with no symptoms, the evidence against it is staggering. Stay with me, because you'll want to hear that one. But first, before we dive in, I want to ask you something personal. Leave a comment below telling me your age and what your biggest concern is when it comes to medical visits. Is it the cost? The anxiety? The fear of what they might find? I read every single comment on this channel. Everyone. Your answer helps me make better videos for you, and it also might help someone else watching who feels exactly the same way. Now, let's count down from 5 to 1. Coming in at number 5, we have routine annual EKGs, electrocardiograms, for adults over 65 who have no symptoms of heart disease. Now, I want to be extremely clear. If you have chest pain, shortness of breath, palpitations, or a known heart condition, an EKG is absolutely appropriate and potentially life-saving. That is not what I'm talking about. I'm talking about the blanket annual EKG that gets ordered for every senior who walks through the door, regardless of how they feel, simply because of their age. This practice has become so routine that most patients don't even question it. But the U.S. Preventive Services Task Force, one of the most authoritative bodies in American medicine, has explicitly stated that there is insufficient evidence to support routine EKG screening in low-risk adults, and that in some cases, it leads to more harm than good. Here's why this matters specifically for aging bodies. As we age, small changes in our heart's electrical patterns become increasingly common even in perfectly healthy people. Think of it like the wear on a car's dashboard. Little scratches and dings that are just the result of years of use, not signs that the engine is failing. When a routine EKG picks up one of these benign electrical variations in a 70-year-old, it can trigger a cascade. More tests, stress tests, echocardiograms, possibly cardiac catheterization, each step carrying its own risks, its own anxiety, and its own cost. A 2019 study from the Journal of the American College of Cardiology found that abnormal EKG findings in asymptomatic older adults led to follow-up invasive procedures in nearly 22% of cases, and the vast majority of those procedures found nothing clinically significant. I had a patient, I'll call her Margaret, 72, from Baton Rouge, who came to me absolutely terrified after a routine EKG at her primary care office flagged something called a left bundle branch block. She'd had 2 sleepless weeks, convinced she was on the verge of a heart attack. After a thorough evaluation, we determined it was a long-standing, benign finding that had likely been there for years. She had 0 symptoms, 0 risk factors beyond her age, but those 2 weeks of fear, those were real. That anxiety has physiological consequences too. My advice, talk to your doctor about your specific risk profile. If you're active, asymptomatic, and have no cardiac history, ask whether that annual EKG is genuinely serving you. Number 4 on our list, routine PSA screening for prostate cancer in men over 70. Gentlemen, this one is for you, and I say it with the utmost respect for how frightening a cancer diagnosis sounds. The PSA test, prostate-specific antigen, measures a protein in the blood that can be elevated when prostate cancer is present. On the surface, that sounds like exactly the kind of test you'd want. But here's the uncomfortable truth that takes courage to say in a doctor's office. Prostate cancer in men over 70 is extraordinarily common, grows extraordinarily slowly in the vast majority of cases, and most men who have it will die with it rather than from it. The National Cancer Institute has described this phenomenon as overdiagnosis, and it is one of the most significant problems in modern oncology. A landmark study published in the New England Journal of Medicine, the PROTECT trial, followed over 1,600 men with localized prostate cancer for a decade and found no significant difference in mortality between men who received aggressive treatment and those who were simply monitored. And yet, when a PSA test comes back elevated, the emotional and medical machinery kicks into gear. Biopsies, surgery, radiation, each carrying real risks: incontinence, erectile dysfunction, infection, and in older patients, complications from anesthesia. Here's the aging-specific biology that makes this especially important to understand. After 70, the prostate naturally enlarges, a condition called benign prostatic hyperplasia, and this alone can elevate PSA levels. Inflammation, infection, and even vigorous exercise can spike the number. The test is notoriously imprecise. Think of the PSA test like a smoke alarm that goes off every time you make toast. It's designed to detect fire, but in older men, it's surrounded by a kitchen that just naturally produces a lot of smoke. I had a patient named Gerald, 74, from Columbus, Ohio, who was talked into a PSA screening during a routine physical. His number came back moderately elevated. One biopsy later, and biopsies are not comfortable procedures, he was told he had a very low-grade tumor. He spent the next 3 years in a state of chronic anxiety, underwent radiation treatment, and dealt with significant urinary side effects afterward. His oncologist later told him that watchful waiting would have been equally appropriate, and his quality of life may have been preserved entirely. The American Academy of Family Physicians recommends against PSA screening in men 70 and older. For men between 55 and 69, it remains an individual decision made in conversation with your doctor. Know your options before you get tested. Now, if you're finding this information valuable, and I hope you are, this is the perfect moment to hit that like button and subscribe to this channel if you haven't already. I put out evidence-based videos every week specifically for people in their 60s, 70s, and 80s who want to make informed decisions about their health. You deserve information that respects your intelligence. Hit subscribe, ring that bell, and let's keep going. Because what's coming next is even more important. Number 3, routine bone density scans, DEXA scans, for women under 65 who have no risk factors and for seniors who have already had a normal scan within the past 5 years. Now, let me be precise. DEXA scans have genuine value for women over 65, women under 65 with specific risk factors, and anyone who has experienced a fracture. That is established medicine. What I'm pushing back against is the practice of repeating these scans every year or two in patients who have no symptoms, no fracture history, and a previously normal or mildly reduced score. This has become a significant driver of overdiagnosis and, critically, the overprescription of bisphosphonate drugs, medications like alendronate, which carry their own serious risks when used long-term in people who don't need them. Here is the aging science. After 65, yes, bones naturally lose density. This is related in part to declining estrogen in women and testosterone in men, hormones that are critical to bone remodeling. Think of your bones like a coral reef. Healthy bone is constantly being broken down and rebuilt in a process managed by cells called osteoclasts and osteoblasts. As hormone levels drop, the demolition crew starts outpacing the construction crew. This is real, and it matters. But a single DEXA scan with a mildly low score does not automatically translate into a fracture risk that requires pharmaceutical intervention. A study published in JAMA Internal Medicine found that among women with mildly low bone density, what's called osteopenia, not osteoporosis, fewer than 1 in 10 would progress to osteoporosis over 15 years. That means more than 90% were being monitored and in many cases treated for a condition they were unlikely to develop. Meanwhile, bisphosphonate medications taken for more than 5 years have been associated with a paradoxical condition called atypical femoral fracture, where the very bone you're trying to protect becomes brittle and breaks in an unusual pattern. A patient of mine, Elaine, 68, from Portland, Oregon, had a routine DEXA scan showing mild osteopenia and was immediately started on medication. She came to me for a second opinion after reading about long-term risks. Together, we evaluated her full picture. She walked daily, ate a high-calcium diet, had never had a fracture, and had no family history. We stopped the medication, optimized her vitamin D and dietary calcium, continued her exercise program, and repeated her scan 2 years later. Her bone density had actually improved slightly. No drugs required. Bone health is real and important after 65, but regular DEXA scans without a clinical reason and automatic prescription of medication based on numbers alone is not optimal medicine. Number 2, and here's the one I promised you earlier, the one that's going to challenge everything you've been told: routine mammography screening for women over 75. I want you to take a breath before I explain this, because I know how emotionally loaded this topic is. Breast cancer is real. Breast cancer kills people, and mammography has saved lives in specific populations. All of that is true. But here is what the evidence increasingly and unambiguously shows. For women over the age of 75, routine mammography screening provides little to no mortality benefit and carries a significant and underappreciated risk of harm. The reason comes down to a concept called lead time bias combined with the reality of competing mortality risks. After 75, the likelihood of dying from something other than breast cancer, heart disease, stroke, pneumonia, another cancer, is substantially higher than dying from a newly detected, slow-growing breast tumor. A comprehensive 20-20 analysis in the Annals of Internal Medicine concluded that for women 75 and older, the number of women who would need to be screened to prevent one breast cancer death was so extraordinarily high, in some models in the thousands, that the harms of screening outweighed the benefits at a population level. What are those harms? They are not trivial. False positives are the big one. Studies show that women who undergo mammography over a 10-year period have a cumulative false positive rate of approximately 50 to 60%. That means roughly half of all women will receive at least one abnormal result that requires a follow-up biopsy or imaging, only to find nothing wrong. In a 75 or 80-year-old woman, a biopsy is not a casual procedure. The anxiety alone, and I cannot stress this enough, is a measurable health harm. Chronic anxiety in older adults is directly linked to elevated cortisol levels, which accelerates inflammation, impairs immune function, and worsens cardiovascular health. Science has quantified what fear does to the aging body. And then there is overdiagnosis. Just as with prostate cancer in men, breast cancer detected in very elderly women is frequently a slow-growing tumor that would never have caused symptoms or shortened life. Treating it aggressively, surgery, radiation, chemotherapy, in a 78-year-old with other health conditions can cause suffering that outweighs any benefit. The American Geriatric Society has formally stated that mammography is of uncertain benefit in women with a life expectancy of less than 10 years. I think of a patient I'll call Dorothy, 79, from Tucson, Arizona. She was a vibrant woman, gardening daily, traveling with her grandchildren, managing her blood pressure beautifully. Her previous physician had her on an annual mammography schedule. One year, an abnormal finding led to a biopsy, then a lumpectomy, then radiation. The tumor was subsequently described as low-grade and likely would not have progressed. She spent the better part of her 79th year exhausted from treatment. She told me afterward, with tears in her eyes, that no one ever asked her what she wanted. No one sat down and explained the trade-offs. She felt the choice had been made for her. This is not anti-medicine. This is medicine done right. Medicine that asks, what are the goals of this person's care? What will genuinely improve or protect their quality of life? For many women over 75, the honest, evidence-based answer is that an annual mammogram may not be one of those things. Have that conversation with your doctor. Ask about your specific risk. Ask about your values. It is your body, and you deserve a complete picture. And now, number 1 on our list, the checkup that surprises people the most because it sounds so sensible: routine full-body CT scans or comprehensive imaging packages marketed directly to seniors as preventive care. You've seen the ads. Peace of mind. Catch it early. Know what's inside. For anywhere from $500 to $2,000, private health clinics will run a full-body CT scan, sometimes called a wellness scan, that images your entire body looking for anything unusual. On the surface, this sounds like the ultimate in proactive medicine. In practice, for the vast majority of older adults, it is one of the most medically harmful things you can voluntarily subject yourself to. Here is the biology you need to understand. After the age of 65, virtually every human body contains what radiologists call incidentalomas, unexpected findings on imaging that were never causing symptoms, and in most cases, never would. A small nodule on the lung, a slight thickening on the colon wall, a shadow near the kidney, a cyst on the liver. These findings exist in a stunning percentage of older adults. A landmark study from the Mayo Clinic found that in adults over 60 who underwent full-body imaging, over 86% had at least one incidental finding. 86%. And of those, the overwhelming majority were benign and clinically irrelevant. But here is what happens next. Once that finding is on paper, once it is in your chart, the medical system is legally and ethically obligated to follow up. More scans, more biopsies, more specialist visits, a finding cascade, a term used by researchers at Dartmouth's Institute for Health Policy that can take months to resolve, exposing you to radiation from repeated CT imaging, procedural risks from invasive follow-ups, and a level of psychological distress that is genuinely harmful to the aging body. Remember, CT scans deliver meaningful doses of ionizing radiation. A single chest CT delivers the radiation equivalent of approximately 100 standard chest X-rays. For a senior who may end up with 3 or 4 follow-up scans over the next year chasing an incidentaloma, the cumulative radiation exposure becomes a legitimate concern. There is also this. No randomized controlled trial has ever demonstrated that full-body CT screening in asymptomatic adults reduces mortality. Not one. The American College of Radiology explicitly discourages these scans in people without symptoms or elevated risk. And yet the clinics selling them are rarely forthcoming about this when they hand you the brochure. I'll tell you about a patient I'll call Raymond, 71, from Nashville, Tennessee. Sharp, healthy, ran 5 days a week. He bought a full-body scan as a birthday gift to himself, thinking he'd get good news and feel reassured. Instead, he walked out with a report listing 7 incidental findings. 7 months later, after follow-up scans, a pulmonary nodule biopsy, and a colonoscopy, every single finding had been cleared as benign. He told me he aged 5 years in those 7 months. His blood pressure went up. His sleep deteriorated. He stopped running because he was afraid. The scan did not improve his health. It harmed it. Now let me bring this all together, because I don't want you to leave here thinking that medicine is your enemy or that doctors are trying to harm you. That is absolutely not the message. The message is this. You are 65 or 70 or 78, and you have lived a life. You have wisdom, preferences, and a deeply personal understanding of what quality of life means to you. Medicine at its best serves those things. Medicine at its worst applies a one-size-fits-all checklist to every body that walks through the door, regardless of that person's individual risk, values, and goals. The screenings I've talked about today are not universally bad. Context matters enormously. What I am asking you to do is become a partner in your own care. Ask your doctor not just, should I get this test, but what will we do if we find something, and will that action genuinely improve my life? Ask about false positive rates. Ask about overdiagnosis. Ask about the difference between catching something early and preventing it from harming you, because those two things are not always the same. You still have extraordinary capacity to protect your health. Movement, nutrition, sleep, connection, purpose. These are the interventions with the most consistent evidence behind them at every age. It is never too late. A 75-year-old who starts walking 30 minutes a day gains measurable cardiovascular benefit within weeks. A 70-year-old who increases protein intake preserves muscle mass and reduces fall risk. The science of aging has never been more hopeful than it is right now, and you deserve to benefit from it fully. Your independence, your vitality, your ability to be present for the people you love, these are worth protecting with information, not just with tests. And the best way to protect them is to make sure that every medical decision you make is one that truly serves you. If this video helped you think differently about your health, please subscribe to this channel and share it with someone you care about. And I'd love to hear from you in the comments. Which of these 5 screenings surprised you the most? Have you or someone you love experienced a finding cascade or an unnecessary procedure? Tell me about it. I read every comment, and your story may be exactly what someone else needs to hear today. I'm Dr. Thomas. Take care of yourself, all of yourself. I'll see you in the next video.